Moving on to the brainstem, your brainstem is divided into three parts: the midbrain, the pons, and the medulla. And these are some of the important structures of the midbrain. You have the mammillary body right here in the midbrain. For pons, you have all the structures going in and out of the cerebellum in the pons, and the medulla have the pyramids and the decussation of the pyramids, which is where the motor tracks cross. But most importantly, you also have the cranial nerves. So it's important to remember where the cranial nerves are located in the brainstem, because when you see patients with specific cranial nerve impaction, even before you see their reports, you can be like, okay, I think there's something wrong with the midbrain for this person. So the midbrain houses your cranial nerve 3 and 4. So it's related to oculomotor movements, and it's with the mammillary bodies, it's related to visual and auditory processing, as well as the inferior and superior colliculi, if you remember. And then it has the substantia nigra, which releases dopamine. So it has these important structures. The pons processes motor information from the cerebral cortex to the cerebellum and then back. And it has cranial nerves 5, 6, 7, and 8. So your cranial nerve 5 is your trigeminal nerve, related to facial or jaw movements as well as facial sensation. Cranial nerve 6 corresponds to lateral rectus and moving your eye laterally. Cranial nerve 7 is your facial nerve. It's related to your facial expressions. Cranial nerve 8 is your vestibulocochlear nerve, and it's related to vestibular sensation as well as auditory sensation. Your medulla houses important structures for cardiovascular control, breathing, head movements, swallowing, vomiting, and sneezing. So it has centers to control all these movements or actions. And it has cranial nerve 9, 10, and 12. And of course, these movements or actions or reflexes are all controlled by these cranial nerve 9, 10, and 12, and some all the other way. Now we are left with cranial nerve 1, 2, and 11. Can you think of where they arise from? I'll not give you the answer. Maybe you can Google it, or I'll release the answer when you come back to class in week 3. So think about it. Next is your limbic system. And this is a hippocampus, which is a hippo sitting in a camp. Find it funny, even if you don't. So this is the limbic system. It is formed of your thalamus, which we covered just now, your hypothalamus, your amygdala, your hippocampus, which is the person in the tent, as well as the limbic cortex and the prefrontal cortex. So all these structures together form your limbic system. And your limbic network is essentially the oldest brain, because the limbic system just works on emotions and sensations. So it is based on alertness, motivation, and learning, but everything is related to survival instincts, emotions, hunger. So if you think about an animal, all their actions are related to either hunger, like they are trying to find food, or survival instincts to ensure that they save themselves from predators. So the limbic system is our oldest brain structure. Now the limbic system does have non-limbic connections, and this diagram seems very complicated, but let's look at an overview of the diagram. So your limbic system is related to voluntary response, and for that your limbic system is connected to your motor cortex, your prefrontal cortex, your basal ganglia. So think about everything that controls motor function, and that's the connection of the limbic system. And this is related to like emotions basically, and maybe for some reason, or I'm thinking of different examples, sorry. But maybe you're very happy and excited for something going on in your personal life, but you're in class, so you're trying to hide or control that emotion, because you don't want to be like jumping up and down. But You can jump up and down. If you have something good to share, you can share it with us and then jump up and down. Basically, your limbic system is connected to your motor cortex to ensure that your voluntary response to emotions is controlled in appropriate social situations. Next is your limbic system being connected to your brainstem and your cerebellum, and these are automatic responses. So, say you're camping out there, maybe in Canada, and a black bear comes along, unfortunately. Now, this is your automatic limbic system being activated. Now, you cannot sit quietly. Now, either you need to do something to run away from the bear. So, that was more of an extreme example, but it does happen here in Canada. So, this is how your limbic system works. It's based on motivation and attention as well as emotions. And it does impact your neuroplasticity, motor learning, behavioral learning. And that's why we are talking about it today, because the limbic system moves us. So, if you think about this acronym, the limbic system is related to M, which is motivation and memory, O, which is olfaction, and this is all related to smell. And our smell does give us some alertness, or the smell sensation or olfactory sensation does give us some alertness and drive. So, for example, you remember your mother's perfume, or your significant other's perfume, and maybe someone else in like a mall or something like that is wearing the same perfume, and whenever you smell that, you feel like those loving emotions towards your significant other, or your mom or anyone else. So that's olfaction. It does drive us. Next is visceral function. So thirst, hunger, temperature regulation, and sexuality is related to visceral function, and the limbic system does drive through these sensations. And then finally, you have emotions. So emotional feelings, body image, and self worth do impact our motor function. And you must be thinking, why are we even talking about this? Because it does impact neuro rehab. So if you think about limbic states, you may see patients in a low limbic state, such as patients with depression, hypotonic CP, or stroke, and you need to get them to an optimal limbic state for optimum or best functional output of your exercises. You may also see patients in a limbic high state, such as TBI, vestibular, and anxiety issues. And again, you need to calm them down and get them to an optimal limbic state so that they can participate well in your exercise plan. So it's important to assess people's limbic state or analyze people's limbic state, and ensure that they um, are at an optimal level of emotional regulation to ensure that they are motivated to participate in your rehab plan. So your limbic evaluation is related to recognizing signs of stress. So you don't have to do a very formal evaluation, but say your patient is like being very loud, or having like a lot of muscle tone, or having a lot of extensive posturing, then it means that they are in a high limbic state. And if their eyes are drooping down, or if they're not talking well enough to you, or talking in a very low volume, and their tone is reduced, that means that they may be in a low limbic state. This is irrespective of their neurological condition. Of course, they may be in a low muscle tone because of their neurological condition, but we are specifically talking about limbic system over here. So you need to analyze these facial expressions, and their voice, and their overall tone and posture, to see what is the sign of stress, and if they need to be calmed down, or to be excited for rehab, or motivated for rehab. You can also measure their blood pressure, heart rate, respiratory rate, sweat responses, and skin color, because it tells you a lot about limbic system. You can evaluate their medical history, because their medical history will tell you about their limbic system as well, and if they have had previous episodes of limbic system disorders. Certain scales, such as depression, anxiety, or consciousness scales, can help you with limbic system evaluation. And we'll know more about these scales when we do the core outcome measures next week. So, as I said, the limbic system does influence your physical therapy because your patient's willingness, motivation, resilience, and adaptability does impact your PT practice. And that's why it's very important to create a good bond with your patient, as well as think about trust, responsibility, flexibility, and openness with the person, because the limbic system is related to motor system. Think about like going to the gym and exercising. If you're not motivated, you will not exercise enough. But if you have like a friend or a trainer with you who's motivating you, you will, even if you're not motivated, you will feel good, and you will do the exercise because you're feeling motivated by someone else and you're getting that good feedback. So here we have an example of positive feedback. Like you have a friend with you going to the gym, you're not motivated, but all that positive feedback helped you do your exercises today and motivated you to come back again. But say maybe you have a trainer who is extremely motivated to the fact that they are giving you extremely challenging exercises and are not able to do any of them, then you will not feel so motivated because you're not able to do any of those exercises and it feels too challenging and it does not have that positive feedback. So again, gaining that good sweet spot where it is challenging enough to gain positive changes in your patient's rehab, but not so challenging that they keep falling every time, is what they need. And that influence of feedback does impact your therapy. So overall, if you think about motor control, you can learn this line over here. Hey girl, I saw you coloring inside the lines earlier, and I have just got to say, you put the fine in fine motor control. Well, don't use that line because it will not work. Um, so here we have the phases of voluntary control as we learned just now. You have, for anything that you want to do, you have planning of movement. Say you want to go for a walk, you plan your movement, you ensure that you have your shoes on, your clothes on according to the weather, and all this is related to your cortical association area, as well as your basal ganglia and cerebellum get input regarding that plan. Your motor cortex then helps you initiate the plan and ensures that you are conducting the plan appropriately. And then the execution of the plan again involves the cerebellum, because the motor cortex communicates with the cerebellum and the spinal cord, and then you finally execute the movement. So everything that we prescribe to our patients, like any exercises, are related to planning, planning, initiating, and executing the exercise in terms of the patient. Like if you tell the patient to do sit to stand activities, the patient first has to plan how to do a sit to stand, like where should their feet placement be, how should they start the sit to stand, and then they would start initiating the sit to stand and then finally execute the sit to stand. So for any motor control, think about it in these terms. And here we have a simple pathway. I'm saying simple because it is, even if you don't agree. But you are reaching for a cup over here, so you have the visual information regarding the target. You know that it's hot. You know what it weighs like. Your frontal lobe is now planning that reaching movement. Your prefrontal cortex is activated, and your motor cortex sends down that command to pick up that cup. Your spinal cord carries that information, and your motor neurons then ensure that you are flexing enough to get those, get your fingers around that handle, and you are providing enough force to reach for that cup. Your sensory receptors in your fingers then send the message to the sensory cortex regarding the hold of the cup, maybe even the temperature. And your sensory cortex says, okay, the cup has been grasped. Your cerebellum and basal ganglia also get that information and say everything is fine with this movement. So the movement is now complete, and the spinal cord then completes the movement. So that's how you reach for a coffee cup, which I think you need now.